right, looks good. Let's jump in. Well, welcome everybody, ladies and any gentlemen in the audience. We're excited to have you on our Galentine's edition of our WIPM mentorship. This is a webinar series that is focusing on mentorship and motion. So if you joined us last time, you knew that we were getting started with taking flight with mentorship and really giving mentorship its wings. We identified reasons why somebody might seek mentorship in certain aspects of their career and their personal life, being a woman in interventional pain management. We know that we're in the minority, and many times seeking out a mentor has provided a lot of growth and comfort in this space for many women. If you are joining us for the first time, welcome. And tonight I'm joined with my co-host, Dr. Kiran Patel. I'm Dr. Jordan Lee Tate. I'm out of Atlanta, Georgia, and we're both founding members of WIPM. We're excited to have you guys online virtually. Today, we're going to be talking about pivoting with mentorship. So again, focusing on that theme of motion. This time, as you may have identified your mentor or places in your life where a mentor would fit in well. Now the question is, you're making changes in your life. You're ready to move from fellowship and get your first job. You're ready to move from academics to private practice or vice versa. And perhaps you've identified a mentor in your sphere that now you need to pivot and find a different mentor. So there's a lot of ebbs and flows that we're going to talk about, some pivoting and changing. And we're going to be focusing specifically a little bit tonight on those changes and where you go from, I feel like this isn't the right fit for me, and now I need to make a change. And maybe it's a small change and maybe it's a very dramatic change. Many of us have gone through this. Often we feel like we're going through it alone or we're the only ones. And so tonight we want to make sure that everybody leaves this webinar understanding that there's probably somebody in this space who has been in your space and been exactly where you are and can give you some amazing insight. And so hopefully we can keep this conversational. We do have a couple of slides to keep this moving. But overall, I want to make sure that everybody feels comfortable putting their questions into the Q&A box. I'll be checking in and trying to wind those into the discussion. And then at the end, we're going to leave some time for that Q&A. So without further ado, I'm going to toss this over to Dr. Kiran Patel so she can introduce herself and kick this off for us.
Awesome. Thank you so much, Jordan. I'm so excited that you all joined us tonight, and we have some amazing guest speakers, Dr. Jackie Weisbein, who needs no introduction, but for those of you who don't know her, she's the current president of WIPM, and Dr. Tejal Raju as well. Super excited for them to share their journeys within pain medicine about how, they had to make changes in their careers. And also how that potentially caused them to make changes and assess their mentors in the moment. And I think this is important. And Dr. Tate so eloquently just stated that, a lot of times we think we are living life in isolation. And really one of the primary reasons for this group, for WIPM, is to really provide that mentorship so that you don't feel alone, that you're facing a particular situation on your own. And so hopefully the stories that we're going to share tonight will help you feel that pretty much if there's any situation that you are encountering, there's one member of the group, whether it's a board member or whether it's a member at large, has been in your shoes or been in a similar situation and can serve as a source of support and advice and, give you some direction when you feel that there isn't much direction. So with that, I think we will really, I'm going to kick it off and have Dr. Weisbein start us off and really kind of, if you could share, I think the critical moments in your career that you had to make a change, and maybe the winds of change, which were making you feel like you needed to make a change, and how you felt internally about that, and also then how that affected your choice in mentors.
Yeah. Okay. Well, first of all, my name is Jackie Weisbein, is Dr. Patel. Can I go back to calling you guys by first names? Because I know we're being super professional, but we're all such good friends. And thank you so much for the kind introduction. I had a really interesting experience. I went to a residency that was predominantly men. And when I say predominantly men, like out of the 23 residents, there were three women, and I was one of three, and each year had one. And I remember the year I was like being asked about, what my program director said, why should I make you chief resident? Like, and I was like, well, I'm really passionate. I work really hard. And he's like, yeah, but none of your co-residents want you to be chief. And it was like, I took so much pride in coming to work and doing what I do that I kind of became a target. But then I was the only one out of my class who ended up at an accredited pain fellowship. And so when I got to my pain fellowship, I was in this great space. I was so happy. I had this woman mentor, Dr. Denise Lester, who's going to be at WIPM this year speaking. And she was so great at helping me feel empowered. But I really thought, like, okay, I don't know if I'm ready to leave the nest. And so my program director, who was also excellent, I begged him, like, hey, can I please stay here? And he was like, no, it's like you got to fly out of the nest, baby bird. And I found a practice in Northern California. I moved to Napa. And fortunately, at the time when I joined this practice, my boss was in a little bit of this like mentorship mode. And so I was really in a position that I could take advantage of that and say, hey, like, I really want to help hone my surgical skills. And so there were certain aspects of this first job that were great. I identified my cases, like I did all my injections, I identified all my trials, and then any permanent pump or stem implant, I put him on a schedule. And he was the surgeon of record, but I was scrubbing, so he billed for it. So essentially, like, I benefited from the mentorship as a surgeon, and he benefited by helping me, but also he billed for it, and everyone was happy. But fast forward, I'm working in this job, and I kind of realized that there were a lot of negative things about the job. Like the managers were toxic, the staff was toxic, and almost every day I would come home crying. And, not to date myself, but this was before 2019, before the formation of WIPM, before our first meeting. And so I didn't really have like my girl gang of people to rely on. And so I was calling my dad. And I was like, Dad, I'm miserable. Every day I'm going to work and I'm crying and this sucks and I hate my job. And he was like, Jackie, you're making a decent amount of money. Just suck it up and just go to work and deal with it. And I kind of feel like that had been the ethos that I had had in like residency, like, this is as good as it's going to get. Just suck it up and deal with it. And so I did really suck it up and deal with it for 5 years at that job of really kind of coming home every day and crying. And finally, at the end of that 5 years, unfortunately, he and I kind of realized we weren't going to be business partners, and we had a really kind of almost catastrophic break. And it happened to coincide with me breaking up with a really toxic boyfriend as well. And so I did what every girl shouldn't do. Like I cut my hair short and dyed a platinum blonde and kind of just was like, I have no idea what's going on in my life. But I didn't really have like a mentor at that moment who could help me, because Dr. Lester, although she's amazing, has worked at the VA for a long time. And so to talk to someone that can give you some insight on how to pivot in private practice was really challenging. And so it created a real void for me that like I didn't know what to do. And so it kind of was going around hat in hand in Napa, like, hey, like, here's what I can do. Here's all my procedures that I've done in the last 5 years. I don't really need you to give me a job. I just need somewhere to 1099 me and help me get started. But I just didn't know what else to do. And I think not having a mentor or even colleagues that I could look to for mentorship who had been in this exact situation made it really stressful and way more challenging than it needed to be. So that's a pretty good summation. Did I answer all your questions, Kieran, or did I miss anything?
Yeah, definitely. I mean, I think in hearing your story, I mean, that's like so much, right? Like, you were obtaining mentorship and in critical like areas of your career, right? Of how to be more of an advanced interventionalist, kind of filling in those gaps, right? From, your fellowship, your training was amazing, your fellowship, your residency, but there were still some gaps that you wanted to enhance your career. And so you gained that from this first job. But can you tell us a little bit more about the things you were feeling inside yourself about the workplace, like specifically of what was really, what didn't feel right to you?
Yeah. So, I mean, I felt a lot of isolation. I think that sometimes, particularly as a woman physician, it's challenging because in most of the healthcare settings, the staff tends to be female. And so there was a lot of feedback like, you can't be too nice to them because if they're your friend, then they're not going to take direction. But you also have to be nice to them and say good morning. So it was like, be nice, but not too nice, smile, but don't smile too much, be visible, but not too visible because you don't want to like obscure the brightness of your boss. And so it was a real gut check of like, oh my gosh, like how can I, like the Barbie movie where, she was like, you got to be pretty, but not too pretty, and skinny, but you can't say you want to be skinny. It was like, how can I be everything, but not be the wrong thing? And so I felt a lot of internal stress and the toxicity of the environment with the lack of support from the women in the office too, because there was some resentment like that, like, oh, here she's a doctor. And so whereas I was trying to kind of distance myself because I was told not to be too friendly, it ended up breeding like resentment in the organization as well. And it made it challenging. I mean, and I'm someone who's been an empathetic and emotional person all my life. And so it really made it so that I was like kind of told like turn off your empathy, like, push your emotions down. Like I remember one time I got tearful in a meeting and I overheard the manager, who was a woman, making fun of me like, oh my God, can you believe that Jackie cried in that meeting? But it was like cry or like dive across the table and choke someone, and like I didn't know how to kind of handle all of this rage that had been building up inside of me for 5 years of like trying to figure out like I'm not doing anything correct and I don't know how to live with that stress anymore.
It sounds like there were a lot of microaggressions in the environment in which you were working in. And that can create a lot of turmoil, I think, internally. How do you feel like where you are right now and how you kind of find that balance between empathy and, just being authentically yourself, and then yet dealing with managing staff now? I mean, how could you compare and contrast that, like where you are now to where you were in that moment?
Oh, 100%. So it's funny because now in my current practice, I'm a partner. So like my managers are employed by me. And it's still funny because whenever they're like, hey, Dr. Weisbein, can I talk to you? My first response is, am I in trouble? And they're like, why? What? Like, it's been like 8 years. Like, can't you get over this? And it's like this innate thing of like, as soon as the manager wants to talk to me, I'm in trouble. But I've learned that I can be friends and, friendly with my staff and my team. Like I just had a birthday party like a week and a half ago, and like the majority of my staff came and my medical assistants were there, my PA, my managers. So, I think that there is a way that you can be like a woman and still be engaged with your staff, be friendly. I think that it's taught me to really also protect my staff. Like when I'm on board meetings with my guys, board partners who are like, oh, like we don't need to have childcare at this event. I'm like, whoa, like we need childcare because like we're asking our staff to come on like a Saturday to an event that we want them to come to. And you guys, I know what you pay your staff because I pay them more than you guys pay. And like the amount, so it's really amazing how different my perspective is. I feel like it's made me re-embrace that empathy of wanting to connect with people. And without having all of those microaggressions that kind of poisoned it or made me feel constantly in fear that like I didn't smile at the right time or I didn't say good morning to someone, that I wasn't going to get in trouble. And I think that now I have a much deeper relationship with my team in a positive way. And so it's enabled me to kind of develop these relationships, which I feel like I lacked so much in my other practice, and allowed me to kind of be back in touch with those feelings and emotions that I want to have because I care. I went into medicine because I care about people, right? And so to be told like you have to turn that off, was the most heartbreaking thing I think ever. So it's been really nice to kind of re-embrace being that version of myself.
I think that's awesome. And I think that's so important. I mean, you should be able to be who you are in your personality as well, right? So as a leader in the practice, right, is one thing, but then to just react the way you normally react, what your instinct is. I think there's imposter syndrome we talk about a lot. We've talked at it on other events, about like technical aspects of our job, but I think there's almost like an emotional imposter syndrome, if you will. It's like, am I allowed to feel this way? Am I allowed to react this way? And so I think it's very common for women in a lot of fields, in a lot of leadership, and in medicine for sure, where we ask ourselves, like, am I allowed to react this way? And we question our emotional interactions during the day, which is a whole nother level from, say, just the day-to-day logistics of the job, right? And I really applaud you for kind of sticking true to who you are and how you naturally react and just allowing your authentic self to shine through. Dr. T, Jordan, what questions do you have about?
I do.
This is so remarkable.
One thing that struck me, you said that you were feeling the pressure to dim your light as to not outshine your partner, because as you were growing in your field, you were really, you were killing it, right? And that was making him feel insecure. And so I think this kind of goes into what Kieran was going to talk about, and we'll kind of go, we can maybe do next slide on that, and she can and talk about that. But the idea of having to dim your light, and now obviously you're in a space where you can shine as bright as you want and own your own ASC. And just how does that feel to have pivoted from that dark space to now being in the light?
I mean, it is it is almost like an affirmation of something that I think deep down you feel like, okay, like I can't be this crazy, that like it can't be that there's something wrong with me. There's got to be something wrong with the situation. And I think that finally exiting that toxic environment. And so when I joined my practice, I joined a group of orthopedic surgeons. So like literally my partners are 5 ortho bros. And I remember coming up to them and like showing them like, okay, here's like a list of all my stuff. Like, I just need you guys to help me out. 1099 me, let me get on your contracts. And they were like, no, Jackie, like we love you. You've been in this community for 5 years, taking great care of our patients. We're going to pay you a draw so that you don't have to like, live off fumes. And then at 1 year, we're going to make you a full equal partner with us. And I think even at that point, they really didn't know the extent of like how much of a hard worker I was and everything. But it's amazing because now I feel like I am valued in such a different way. Like I had a shoulder surgery and we were interviewing a new total joint person. And I'm obviously not a total joint person. And so like my one partner who does total joints calls me and he's like, hey, did you have a chance to interview this person? I was like, no, but like I just had surgery. Honestly, like I trust you guys. And he was like, no, you're a partner. I'm coming to pick you up and I'm going to take you to meet this person because your input is valuable and we care about you. So I think being able to recognize like where you are not being appreciated, like people show you who they are and you should believe them. And for those 5 years that I was in that practice where like I was going home and crying every day, like even though my dad was like, Jackie, just suck it up, I really should have known in my heart of hearts, like this is not the space for me because like it's already what we're doing, taking care of these patients is already hard. It's already challenging. Like it's already hard not to take on their suffering with you. Like you have to compartmentalize it, but also like to then be in an environment where you feel like you want to cry every time you leave and you're not sure if you're crying because you had such a terrible day at work or you're crying because you're just happy to be gone from that space, and to be 180 degrees in a different place where it's like I get to put unicorn wallpaper in my bathroom and I have a sign that says you're amazing, like that's neon. I mean, and they're like, Jackie is amazing and she's, does everything. And like it's just the feeling is something that I don't think I could put words to other than I didn't know what it was like to be valued until I was finally in a position where my partners truly valued and appreciated me. And I look back and I wish that like I had someone like me at that time to like kind of shake me and say like, Jackie, like get the heck out of this because it's a terrible place and all it's doing is like, making you feel small, and nobody should make us feel small, man, woman, anybody. Like it doesn't matter who it is. Like, we put so much time and effort into our careers, and I don't think that anyone should have their shine diminished.
I think these are great pearls. I think you were not lucky, but you worked hard, right? And so I don't want to say lucky, but you found appropriate, good business people to align yourself with, right? What advice would you have for somebody who's struggling to find those people? How do you find the confidence in yourself to ask for the things that were suggested and presented to you?
So I think the first thing is, to understand what your value is as a pain physician, right? So at some point, I started my first job working on production. I got a salary of like $8,000 a month for the first 3 months, which in California was basically like, it paid my taxes. And so I didn't know that because I was naive enough to think, New York's taxes were bad. California's are going to be the same, and they were all pretty bad. But anyway, so in retrospect, like I was used to kind of working really hard. But what the first thing I did was I kind of looked at every CPT code and I looked up what the value of my time was worth. So I knew what the value of my dollar, like every minute of what I did was, whether it's a clinic, injection, or whatever. And the reason that I made sure that I understood that was because, like, there are a lot of groups who tell you things like my ex-boss told me there was no money in the ASC. Like there was no like everybody that joins an ortho group or a neurosurgery group, like you're just going to be a needle jockey, but you only are what you are told that you are. And if you don't know what you're supposed to be because you're telling yourself, hey, this is what I actually am, this is the value that I bring, these are the skills that I bring, then how can you know where like there is not a place for you to be? So I think first understanding those values, and I hate to put a numerical value on it, but I mean, when we're looking for a job, how do you know what to ask for? And when you're first starting out, it's challenging because no one's rushing to a new practice to visit the new grad, right? You're not a draw, you're a money loser, which makes it challenging. But I had already had this 5 years of experience and I was lucky enough to stay in my own community. So I had a name for myself. So I had a draw. I just needed a place to kind of work. I think being honest with yourself about your confidence level, like if you're fresh out of training, Jordan, there's something that you said to me a couple years ago at another conference that like I repeat all the time and I attribute to you, which is, understanding the difference between competence and confidence, right? And there are a lot of people who leave fellowship with a lot of confidence but lack competence. And I think I had the competence, but I lacked the confidence. And so making sure that you have both of those things aligning is going to help you be successful, right? Because if it's competence without the confidence, you're not going to put yourself out there. But if it's the confidence without the competence, then you're just going to hurt someone. So I think having like a group of people, whether it's your friends, I mean, let's be honest, we all still text each other and ask for advice when there's a question that we don't know. So, finding the people that you can relate to and ask questions to is so important, but also like that I had to put all this stuff together because I didn't know who to ask. And over the years, that kind of cachet of information of like reimbursement and my value and where I can be has evolved because of my friends and mentors helping me identify what that value is. So
I remember that moment very clearly. I saw the light bulb go off when we talked about that. No, I think that was all very beautifully said. I want to pivot now and I want if Karen, if you could give us and Lauren, if you can go to the next slide. Karen, if you could tell us about the tall poppy syndrome and how that beautifully relates to Jackie's experience, and then we can transition into talking to Tejal here.
Yeah, I think all of us need to be kind of aware of this term. I actually became aware of it this year. I described a situation to a friend of mine, and he was like, "Have you heard of something called the tall poppy syndrome?" And I said, "No." And he goes, "That's what's happening to you." And I said, "Oh, huh." And so then I did a little deeper dive. And so for those of you who aren't, aware, I mean, obviously it's Galentine's, day, and we're trying to celebrate here with WIPM, but the red flowers that we used on a lot of the promotions has nothing to do with Valentine's Day. So the tall poppy syndrome actually refers to people wanting to cut down another person who stands out as a high achiever. The term references an image of a poppy, just as this picture here, that grows taller than the rest of the flowers or a field or a garden. And so, some of the examples, I mean, they often say that tall poppy syndrome is really what's manifested particularly by jealousy, sexism, competitiveness, or other factors that motivate people to react negatively to other accomplishments. And this is most particularly in the workplace. And so on that list of examples of tall poppy syndrome is, ignoring or silencing somebody who may be a high achiever, mocking them, bullying them, cyber bullying them, undermining their work, taking credit for their work, unfairly criticizing or berating or disciplining them, dismissing or downplaying their accomplishments, gossiping them, being openly hostile. Some other more subtle versions of it is labeling them as an impossible perfectionist, or barring them from promotions, or accusing them for being aggressive for speaking up, or accusing them of being overpaid or overly emotional, sabotaging their work, insinuating that they didn't achieve their success through hard work and legitimate means. So I think much of what Jackie described, so many different elements of it, are really encompassed by examples of this kind of tall poppy syndrome. And this is something that, is quite popular in Europe, and really is used quite often to describe women who are very successful in their field, and attempts to kind of bring them down. And so I certainly see that resonated in your story, Jackie. And in learning your story, Tejal, I definitely think there are elements of that. So without further ado, I'm going to turn it over to Dr. Raju, and I'm going to ask you to share, just as we've done here with Dr. Weisbein, is, what was the time in your career where you needed to pivot? How did that make you feel internally? What were the factors that might have led up to that? Maybe some of it's the tall poppy syndrome. Maybe it's some of the microaggressions in the work environment. Just what was that buildup to that transition? And how have you used mentorship to kind of help you through that transition?
Sure. Well, first of all, thanks for having me. It was nice hearing Jackie's story because it has the happy ending. She learned from her mistakes and their challenges. For me, I just made this pivot, so a lot of this is very fresh for me. So I came out of training about 13 years ago from Pain Fellowship. And during training, I felt like it was the attendings, your co-fellows, they serve as your mentors. They're guiding you through those early years. But once you leave that structured environment, you enter the real world, and you're needing a new mentor because you're in a very different practice setting. And I feel like if you think you don't need one, that's actually a dangerous mindset. No matter how much you've learned, no matter how confident you are, going back to confidence and competence, you should never feel like you know everything. There's so much to learn once you head out into the real world. And what I've come to realize, even 13 years later, I still need a mentor, which I think I didn't realize till recently. So you'll accumulate, tons of medical knowledge, gain thousands of hours of patient care experience, you'll grow, but your mentor remains vital. And you may have to change mentors, and that's kind of what we're talking about today. I can't imagine anyone in the healthcare field who doesn't appreciate sharing ideas or discussing cases, discussing treatment options, but you'll still want to discuss, your personal growth and development. And as you evolve, you'll need someone to guide you, not just as a physician, but as a person. And I think mentorship is so important in medicine because medicine's not an exact science. It's always changing, evolving. Gosh, in the last, 10, 12 years, what I learned in training is completely different. There's new techniques constantly emerging. I mean, even for example, when you're treating neuropathic pain in your hand, you can ask 10 different people and they'll give you 10 different ways to treat that pain. So when I finished training, my mentor was the one other pain physician that I worked alongside with in my local hospital. And it worked out well because they were ahead of me in their career. They're 5 years out. They're already navigated the challenges of the hospital and the community that I was just about to face. And they were really great. They offered great guidance, supported me, taught me things, gave me confidence. They really shaped who I am today as an interventional pain specialist. But think people change, and I think I learned also it's also important to have more than one mentor and to continue to you know, be out there in the community. And that's why I came to WIPM later, but I think by coming in later, I've made so many more friends and gotten more mentors actually. So as I progressed in my career, over time, I started to feel like my professional needs. So I aligned with this physician. We opened up a practice. I was never partner, which didn't bother me until, 5 years in, and then COVID happened and it was a little messy there. And I just kind of kept quiet. I got a decent paycheck. Everything's good, taking care of my family. But then our goals just didn't align together. And over the past couple of years, I just felt like I was in a challenging position, not receiving the support. So, for example, I would email. It would take 1 or 2 weeks to get a reply on the email, or I would text, get no response. I may even call and not get a call back. And, oh, they're busy. So, I felt like people talk about toxic work environments. I didn't feel like I was in them because usually toxic work environments, you have a lot of hostility. This was the opposite. It was felt neglected actually. And like I was on an island and not getting resources to better my practice. And the workplace dynamics just became more of a struggle. And patient complaints then reflected poorly on me instead of the practice. It was, my fault that things weren't being done, but I didn't agree with things being done in the practice in a certain way. And I couldn't change that because no one was listening. So it became clear to me that I had to change this. I was, I was doing over 100 procedures a week, but being told that that wasn't enough for me to grow into a bigger place. That wasn't enough at one point to get a new mid-level to help me. Because, I left at certain times to go take care of my kids. And that felt like a punishment too, that I couldn't say, I felt like I couldn't talk about my family even at work because it was negative, like because that person didn't have those obligations and I needed to be at work and produce and it just felt guilty about things like that. So then I called up different people and surprisingly, all the friends I had made were great mentors and actually picked up the phone right away and talked to me about my experience, what I was going through. Despite having very busy schedules, they took my call, listened, shared experiences, gave me mentorship. And what I learned too is better to have multiple mentors than just relying on one person. And what I was missing was just honesty and transparency, which was really refreshing. And that's what I got from those that, gave me the advice. And then after being burnt out for, over a year or two, I was like, this is it. I need to pivot. And so I recently have resigned and looking, to start a new adventure. That's where I am in my career.
Thank you for sharing your story very transparently. There's a lot to unpack there. There's a lot of pearls in there. One thing you said, it doesn't meet the definition or it didn't feel like it was classically toxic in a way. And yet there was a lot of toxic accumulation that felt like it wasn't sustainable. I'm sure at some point you had a conversation with yourself or your husband, and you thought, how do I play this out and how do I stay where I'm at and keep this going, but make some changes versus when do I pull the ripcord? Can you give us a little
Yeah,
spotlight on that and
without
like
being,
how that process went
it
and the
actually,
things you thought about?
so what Jackie said about value and your time, and I finally once I realized things weren't working well, I sat down and I looked at numbers. I'm like, wait a second, there's no way, that if I'm producing this much, why can I not grow? That just doesn't make any sense. It and I said, let me make this work because it's really hard. Two things: you're leaving a stable paycheck and you're also leaving your patients. So you feel like if you say no more, you're neglecting, especially in my area, it's a rural community. And that was heartbreaking, so I tried for a year and I tried for a year to open the communications. Like I said, you know what? I want to have monthly meetings. So we did that. But when we did that, I brought everything to the table with no response. It was just like, yep, nope, doesn't sound good. Nope. Okay. I was like, but this is not what I meant by having a monthly meeting to discuss, my location and my practice. So little things like that. For a year, I tried to make things work. There's favoritism in the office. I'm like, you have to stop that. Like, you can't let this one person close charts later than this person, for example. Like, it has to be standard, things like that. And yeah, well, one more time. It took a year to finally say enough is enough. And things just build up, and not going into details, but like it was one last thing. And I was like, I can't now. I can't do it. We were actually going to expand into a location, and we almost had closed like the person's ready to move out of the building. They packed up their supplies. Even my manager knew, everybody knew. And at the last minute, there's like, but you still don't make enough, so we can't move. I'm like, but we did all this for 3 months. Like, I spent hours on the weekend trying to arrange this move into a new location. And now all of a sudden we can't. Like, you didn't know 3 months ago that we weren't making enough, which I still don't understand how we're not making enough to move from one space to a slightly larger space.
For sure. Just a comment for anybody, maybe in training or fresh out, 100 procedures a week is a lot. It's a whole lot. It's very challenging to my brain to understand how anybody could ask you to do more or tell you that you weren't a valuable asset. So, Karen, I see it looked like you might have had a question. Oh, you're on mute, Karen.
It's so many things. Tejal, thank you so much for sharing your story, especially because it's so fresh. And like that takes a lot of courage, because like you said, you're kind of like in the middle of it. You're kind of like transitioning now. You're deciding what your next move is. And really appreciate you sharing it with all of us. And one thing if I could give a Valentine's Day present to everybody who's watching this and all of our members, honestly, what I hear and what I recognize within myself is like, we don't listen. We don't listen to ourselves. We don't do a gut reaction, right? We're in the most challenging field. We listen to patients pour their hearts out about how their pain implicates their life, how it's so challenging, and we give all of our empathy. And I think, Jackie, you said it, this job is hard. We lay like ourselves out there and we really give ourselves to our patients, but we don't do gut checks, right? We question how we're feeling inside. Like, you'll feel something, but we'll push it down because the system, in some sense, like the medical training system, has made us think, okay, if we just put our heads down and we work harder, it'll be fine, right? I think a lot of us who are high achievers and women who are in a relatively male-dominated field still think that the best way that we can make our name is by putting our heads down and working really hard. Right? Okay, 100 procedures a week aren't enough. I'm going to do 125. I'm going to do something that's superhuman, and I'm going to have a family, and I'm not even going to act like I have a family because I'm not allowed to talk about it at work, or I'm not in an environment where that's conducive. And so, if we did it, if our patient said that to us, right, we would have so much empathy for them. And I think we need to have that for ourselves. And we need to listen to our gut check, right? And I'm not saying just for you, Tej. Like I see it in myself. I hear it in Jackie's story. You know, Jordan and I have touched base on this before. You know, I hear this with so many women that I interact with. And I just think that, you know, the tall poppy syndrome is relevant, right? There's gaslighting that can happen in a very obvious way and then in a much more subtle way. Yes, they're finally granting you a meeting to meet on a regular basis, but they're not really listening to your suggestions.
Yeah.
And, you know, at the last minute, like as Jordan said, you know, 100 procedures a week, if they're not saying that's not making enough for you to move to another position, honestly, I would say then they have to look at what's going on in terms of how they're running the practice, in terms of how are they doing the billing? How are they doing the collections, right?
Yeah.
You know, are those patients in network, out of network? Are they collecting on the out of network patients? So there's a lot of questions there, which clearly the environment you were in, they weren't ready for it. It just burns me up inside. Like I feel for you. And I think
Yeah.
that's
And,
one.
you know, I was naive. And that's one thing, like to know those things early, to know what you're worth earlier. I thought 5 years ago, I thought that was normal. I was like, everybody does 70 to 85 procedures, 100. I just thought that was the norm. And when I went, you know, out and talked to people finally, no, we don't. That's crazy. And I was like, well, maybe it's because we're in an office. I don't,
Yeah.
Joel, you were doing a great job. And Kieran, not to jump in, but I just because I was looking, Jessica asked some questions about, you know, people who can't leave. And it sounds like Tejal, both you and I were in some positions where it was like challenging to leave the patients. And so when I gave my talk on leaving a toxic job a couple years ago at WIPM in Scottsdale, where we're coming back this year, one of the things that I really learned in my experience about like staying, because I think probably by like year two and a half, I was kind of like, I'm trying to make fetch happen here, but it's not. And to be perfectly honest, like, you know, while you're there trying to make it work, I mean, we've all been in like probably bad relationships where we were like, we're just going to try and make this work because we're just the type of girls that don't give up. And so I think the important thing to realize is that nobody at work is really your friend in a toxic work environment. And so any plans that you have about maybe leaving or maybe doing something, you can't talk to people at your work about it. This is something that you hold close to your chest and you talk to your friends like in WIPM or outside of this, because unfortunately, like people at work talk, and there are a lot of people who you might think are your friend that might end up really like stabbing you behind the back. And that's kind of what happened to me, which is why my exit was a lot more rapid than I expected it to be. And then also, you know, the truth of the matter is understanding like, you know, what are your options for leaving? Because like, let's say you're in a state where you can't leave because there's a non-compete, or and you have a family tie, or your partner is a physician or in a job in that area where you can't leave. And so, you know, being able to survive in that situation is really challenging, especially when it's taking a toll on yourself. So you have to kind of carve out self-care options for yourself, right? So I bought horses, I took up golf, I, you know, did a lot of things that I had that were going to give me joy outside of work, so that like whatever misery I was in at work wasn't like encapsulated by just, you know, that was my life. Although so much of work is so much of our life, which makes it really challenging. But I think, you know, trying to kind of figure out an exit strategy if possible, but otherwise I think getting even help from a therapist, and also like how do I manage this situation without it negatively impacting my mental health, can be also a really good survival tip. And I just wanted to say a few of the people in the comments had said, you know, thank you. When I put my cell phone and my email out there, you know, I really mean it. If you guys want to reach out, we're all friends here. The goal is to, you know, create an opportunity to help people. So if you feel like something that I said or Tejal said or Jordan or Kieran said has resonated, like we all are out here to help each other. So to the other question, which is what do we look for in potential hires and mentees? I think we all want someone who's a go-getter, right? No one who feels entitled, no one who thinks like I made it here, I deserve this, right? I don't think any one of us on this panel or anyone on this call is like, I deserve this. I know Rosa, who's on the call, like she approached me at WIPM and was like, can I come and like work with you in Napa? And I'm like, me? And she's like, yeah. And I like made her work hard because I knew she was going to go see Tim Deere. And I was like, I don't want Tim to think she was an idiot and I didn't take care of her. So like, I really worked her to the bone. But I thought how amazing of this woman who like is putting herself out there and making an effort. And I think, if you find people that you can make an effort and they want to help you get that leg up, like, hold on to them like for dear life, because those are going to be your friends forever.
Yeah, I think just to piggyback on, well, Jess's question about when you feel stuck and you don't have the opportunity currently to pivot, and I resonate with that. I stayed with a job that I didn't find a lot of happiness in for several years before I decided to break free and start my own gig. But some of the things that I did to at least palliate and make it more palatable for a temporary time were adding different service lines, such as research, getting engaged in that, and the pressure to perform procedures when it feels like it's never good enough. The more you do, the more they expect, the more they expect, the more you start doing, and then next thing you know, you're walking around glowing because you've been radiating yourself for for so many hours. So I think sometimes you need to take your situation and say, okay, how can I make the best of this, right? And often that does require some external viewpoint. It takes relying on your friends, looking for a mentor to break it down for you and say, you're not stuck, you're just inert. You're just stale, right? Like how can we revitalize the situation that you're in so that you can enjoy what you're doing again? And I think that that's where WIPM and identifying mentors can be really helpful for you because for me, I mean, Jess, who wrote the question, she was one of the women that I looked to who was doing research in her practice. And I said, well, okay, well, I can do that too. Let me figure out how to do that. Right. And so by adding that, I created value in my sphere. I was able to carve out some time and focus on research, and I made it more palatable for a time being. Ultimately, I decided to leave as well. But I also, have spent the past weekend talking to one of my friends who's in a totally different field. She's in the fashion industry, and she's very, very stuck in a job that she finds toxic. And, a lot of it, though, was really you get kind of stuck in this rhetoric and this conversation in your head. And just the act of spelling it out to somebody who maybe is completely outside of this field, has no skin in the game, doesn't have any biases in the experience that they're bringing to the table, but perhaps can look at this with fresh eyes. It was a very impactful conversation where I was able to highlight some things that are wonderful about, the career that she's in and the importance of the work that she's doing. And through this conversation, she really kind of got revitalized and jazzed about some of the positive aspects of her job. And she's like, I've had 100 conversations with women in my field, and they keep telling me the same thing. And yet I went outside and I had a fresh perspective, and you're telling me things that I'd never even thought of. And so that's something else to think about as you're seeking mentorship. You know, maybe it's somebody that's not stuck in the quagmire with you, but can see it from an elevated perspective as well. So that's always something to consider. Let's see, do we have any other questions? Anybody else with questions coming in?
I think,
Rosa, your
yeah.
mentee, has chimed in with a few questions. What strategies have helped you speak up effectively in situations where you feel dismissed or overlooked? And many of us hesitate to speak up for fear of negative consequences.
So I have recently been utilizing ChatGPT to help me understand and reduce what is a perceived aggressiveness in my tone. I think that I'm a very direct person, and I think that sometimes when women are very direct and matter of fact and are saying things without emotion, it's perceived as being like super bitchy, for lack of a better term. And so sometimes when I feel like that, Rosa, what I do is instead of I'll say, you know, let me think on this for a moment and get back to you. And then I'll angrily type out what I want to say into Chat GPT. And then I'll say, help me make this sound less aggressive, but still convey like the underlying emotion of what I want to convey, which is either, you know, like my disappointment or my whatever it is. And it has actually helped me also learn. I mean, I know it's supposed to be artificial intelligence, but it's actually helped me kind of learn how to adjust my tone in real time. Um, and to be honest, I've used it actually when I want to text my boyfriend something too. So like it's helped me navigate my personal relationships as well. But I think that it's important that if you feel something, I mean, first of all, if someone is like directly rude to you, it's okay for you to call them out and say something like, I want to make sure I understood what you were saying, right? So if someone's like point blank rude to you, like, can you clarify what you meant by that, right? So if someone's making a joke at your behalf or something like that, because that forces them to repeat something that was otherwise inappropriate. And then if you are like hurt about something and you don't know how to feel about it, I think it's okay to like take time and like review that. And like Jordan said, talk about it with your mentors, with your friends, with your coach, whoever, your therapist. Don't ask my dad because he'll just tell you to suck it up. But realistically, to take some time to digest it and think about, you know, how did this really make me feel? Because sometimes in that moment when you're really upset or you felt overlooked, maybe you perceived it in a certain way, and think giving someone an opportunity to just like later without the emotion involved in it, say, hey, you know, I left that situation really feeling like you were diminishing my opinion or that you weren't giving my what I was trying to say a moment, and maybe I misinterpreted it, but was that what you were trying to do? And I think giving someone an opportunity to explain rather than assume the negative is the best thing to start with. But then also recognize that, like, what are the negative consequences? That you are doing the right thing for yourself. And if advocating for yourself is a negative thing, then that's a space that you don't want to be in. Did I pause? Or was that me? Sorry.
No, that was amazing. Tejal, do you have anything to add to that? I mean, as you were going through some of these meetings, I'm sure there was, you know, some hesitation and fear. What did you use to kind of make fetch happen, as Jackie says?
Dating myself.
I love it.
You mean the meetings where I had met with the team?
Yeah, I mean,
Kind of
or in
better?
other experiences where you really felt like, you know, your voice had been um quieted and you needed to speak up.
Yeah, I mean, I realized, I think, after those meetings that I really was talking to a wall. And so I think just to take a step back and talk up to others, make sure everyone wasn't treating me like a wall. I think I learned I needed to get out there and again reconnect with others and find people that aligned with my values and my patient. I think I'm very patient centered in my treatment, and I feel like I needed to talk to people that had that type of the same goals that I had. And if what I learned was, yeah, getting out there, just honesty. What I wanted the most was honesty and transparency and availability too. If someone doesn't have a second to text you back, I know we're busy, but even the next day, I just think that's rude. Mm-hmm. And that should have been the first sign for me. You know, and I think no one's that busy. And if they're that busy, then that's not someone you need to align with if they can't communicate with you.
Well, I'm so proud of all of you for finding your voice and stepping out on your own power. And if you had to look back in retrospect, how would being a part of WIPM earlier in this process, or knowing that you had these potential mentors out there, have changed and shaped your experience?
I mean, I will start. I mean, I think that the evolution or growing out of mentorship, it's not just that you grow out of it, it's just that you become friends with these people, right? Like you get to a point where the advice flows back and forth both ways. And I'm so grateful for that. And I'm so grateful for being able to be vulnerable with people that I respect and admire, because I think, we're all scared. Tejal, I remember going through exactly what you were going through 7, 8 years ago and feeling so afraid, like how I put all of this life's work into things, and what am I going to do now? And I think, having a group of people, a cohort of people that you can rely on and respect and admire, like, I mean, am I ever going to outgrow mentorship? Absolutely not. I'm always going to need my friends at some point to help mentor me. And I always love trying to be someone that's available for other people so that they don't have to suffer. And I think creating this organization, and I look at Jessica as someone who, like, what a brilliant idea. And thank you, Jessica, for starting this. But I look at her and I think, it only took one spark, right? And she was the spark. And now here we are all these years later. And I think that if I had this group of women, and I mean, women in neuromodulation was amazing, and it was as part of NANS, but I don't think we developed the same network of support that we have developed with WIPM. And I think with this network, if I had this 7 years ago, I might not even be in Napa. I might be somewhere else. I might have never joined my first job. I might have known better. But I think that, I hope that people continue to hold the torch of WIPM and the support that we've developed, because, we could save each other from a lot of heartache.
Yeah, well said. I will be honest, I was a little late to the WIPM game, and I came last year to the conference, and it was the first time I felt so free. I don't know, I feel, when we go to these conferences, and even when I went to NANS a few weekends ago, and every time I go, I look around, I'm like, oh my gosh, there's so many men here. And it's just not the same feeling of being free, of, being allowed to talk about your kids, your family, girl stuff. Heck, they had shoes at WIPM last year. That was so fun. Being able to try on those shoes. But and I agree with what Jackie said. If I had been a part of WIPM 5 years ago, maybe I would have pivoted way back, and and learned the lessons a bit sooner. So I really appreciate being welcomed into the WIPM family now, and I looking forward to Arizona.
Well, we're also proud to have everybody here as part of the WIPM family. Thank you all for participating and typing in your questions. If you aren't aware, we are hosting our annual conference. Not only is our registration open and rooms filling up fast, but our abstract portal is open. So anybody who is interested, even if it's your very first time and you just have an interesting case report that you want to write up, please submit in the abstract portal as well. And you can feel free to wear your pink suit or whatever you want to wear. It'll probably be hot. It's going to be amazing. Dr. Patel, Kieran, do you have any final words for us?
I just want to thank Jackie and Tejal for sharing their stories with us, and for all of you for, continuing to be part of this series regarding mentorship, and continuing to be part of this community and growing this community. And I would encourage you to, think about some of the stuff we talked about tonight. And if you can relate to anything that was spoken about, seek the advice of your mentors, to do a gut check and to see, hey, should I be dealing with this? Is this the right place? Is this serving me? Ask these questions and talk to people who you feel truly support you. And if you don't feel like you have somebody, reach out to any one of us or any one of the board members on WIPM. We'd be happy to, be that person for you, or find you somebody who we think might have just gone through the same exact thing you've gone through. And, it's really important to understand that, you know, you should feel supported in your work and you should feel proud of the work you do and your contributions to whatever work environment you are. And I think we often, put our heads down and say, hey, I'm just going to work harder and that's going to figure everything out. Sometimes it's not about working harder, it's about working smarter. And so, with that, for those of you who have not registered for the annual conference, please do. We all look forward to meeting you, and to seeing how we can support each other moving forward.
Happy Galentine's Day.
Happy Galentine's.
Valentine's, thank you.
See you guys in Scottsdale.